Your heart rate before you get out of bed in the morning tells you how you are that day. Your physical fitness, nutritional fitness, mental function, and how well you slept all night. I'm Dr. James Hurd, a physician specializing in preventive behavioral medicine and cardiovascular rehabilitation. Heart rate measured first thing in the morning is called basal heart rate. A good way to measure basal heart rate is to count pulse rate first thing in the morning lying down before even getting out of bed. In general, the lower the better. At age 50, basal heart rate of 70 beats per minute is average. Not good, not bad. Less than 60 is very good. Greater than 80 is very bad. Best of all is a basal heart rate less than 60 beats per minute that does not increase with age. Heart muscle keeps contracting and relaxing rhythmically without ever stopping. Unlike other muscles, heart muscle never gets tired. Pacemaker cells in the heart initiate rhythmic contractions. Without any other stimulation, the heart contracts spontaneously about 100 times a minute. Additional control comes from metabolism, nerve stimulation, and circulating hormones. At rest, the normal heart rate is slowed to less than 70 beats a minute. Each contraction of the heart creates a pulsation that can be detected in the arteries, at the wrist, neck, ankle, foot, or in the groin. All that's needed is a watch with a second hand or a digital display of seconds. Most convenient of all is a digital stopwatch. To measure pulse rate at your own wrist, put your index and middle fingers on the front side of your opposite wrist just below the base of your thumb. Count each pulsation you feel, starting with 0, then 1, 2, 3, to at least 10 for at least 10 or 15 seconds. Optical devices measure change in color of skin at the wrist using a wristband, or from a finger using a finger clip or a camera on a smartphone with a mobile app. The electrical signals from the heart can be detected from the skin surface. Detected and recorded, they make an electrocardiogram. However, it requires a chest strap or connections with two limbs to record electrical impulses from the heart. In type 2 diabetes, basal heart rate becomes a fuel storage gauge. When we've been eating more than we can use or quickly store, basal heart rate goes up. That indicates there's high levels of insulin in circulating blood. It also indicates sugar and fat are spilling over into places where they do harm. Also, insulin acts in the brain to stimulate spinal nerves and increase the rate of contractions. Insulin resistance, with increased levels of sugar, fat, and insulin in the blood, causes increased heart rates. Resting heart rate is a long-term predictor of heart disease and early death. For example, results related to resting heart rates for 800 men who were 50 years old were reported initially and then over the next 20 years. Those with initial resting heart rates over 75 beats per minute had double the risk of those with initial rates of 55 beats per minute or below. As a predictor of type 2 diabetes, resting heart rate also has been studied. A group of 70,000 people in Asia was studied for 4 years. During the next 4 years, 24% of the people developed prediabetes and 6% developed diabetes. The figure shows that the top 20% of people who had the highest average resting heart rates of 88 beats per minute had almost 50% more diabetes than the lowest 20% of people who had resting heart rates of 61 beats per minute. Resting heart rate is strongly related to physical fitness. A total of about 2,700 subjects in Denmark were followed for 16 years. In this study, the assessment of physical fitness included measurement of maximum oxygen consumption during a graded exercise tolerance test. As shown in the figure, those with the lowest resting heart rates were able to do the most physical work. Both physical fitness and resting heart rates were strongly related to eventual death rates. However, statistical analysis also demonstrated that resting heart rate had an independent relation to mortality. Resting heart rate also is related to calorie restriction. Resting heart rates of men and women who restricted calories to about 1,800 calories per day have been compared to resting rates of men and women who consumed about 2,500 calories per day. Average nighttime heart rate while sleeping was 50 beats per minute in subjects who restricted calories, compared to nighttime heart rates of 81 beats per minute in subjects who consumed about 2,500 calories per day. Nutritional fitness with long-term calorie restriction also affected cardiovascular health and risk of heart disease. Resting heart rate also is strongly related to insulin resistance. Both insulin resistance and resting heart rate are associated with increased sympathetic nervous system activity. High basal heart rate is an indicator of chronic disease and a predictor of type 2 diabetes. The most effective way to reduce basal heart rate is exercise training. Calorie restriction, which reduces percent body fat, also reduces basal heart rate. If you would like to participate in our type 2 diabetes recovery program, you should sign up. Click on the link in the video description. After you sign up, you'll be asked to register and supply a few points of data concerning date of birth, smoking history, height, weight, blood sugar, and daily injections of insulin. We will call you and establish secure communication links for reporting and reviewing results, starting with fasting blood sugar, basal heart rate, and body weight. Then I will call you to ask about your medical history with type 2 diabetes. Also, we will discuss details of your goals and objectives for recovery from diabetes. In addition, we will set up an action plan for recovery. There is no charge for this service as long as you continue to report on a regular schedule and continue to work towards recovery from diabetes. We are dedicated to helping people recover from type 2 diabetes and maintain good health using telehealth technology.